I'm going to demonstrate how to maintain a patient's airway where the patient maybe is unconscious and you want to keep their airway open. So there are two methods of first opening the airway. The first one is the head tilt chin lift. And you use this in a patient who you do not suspect to have any C-spine injuries. And the main thing is by holding the patient's forehead, you tilt the head and chin lift. Okay, by that, then you open the airway and you're able to see that the airway is open, and then you can proceed and then put an OPA, which I'm going to demonstrate in this video. The other way you can open the patient's airway, and this is where you suspect the patient is having a C-spine injury, is what we call the jaw thrust. And the key thing is you want to put your the thinner parts of your hand on the patient's chin, and your fingers are behind the mandible to lift up the mandible, and you can use your thumbs to actually open the airway in what we call a triple airway maneuver. So essentially my hands on the patient's chin, on the patient's cheekbones, my fingers are behind the mandible, all right, and my thumbs are used to open the airway, and this way we maintain an open airway without actually moving the patient's C-spine. All right, to insert the OPA, it's very simple. You want to size an OPA, so it's an oropharyngeal airway. You want to size it from the corner of the patient's mouth to the angle of the mandible in a non-smiling patient. We insist in a non-smiling patient because in an OPA situation, you don't want to put it in a patient who has a gag reflex. So one of the things you need to make sure is your patient does not have a gag reflex. And it's very easy to insert. Once you've sized it and you're sure it's a correct size, then use a tongue depressor, use your thumb, use your finger, use any device you may have to just hold up the tongue and just slide it into the patient's mouth, okay? Now, a couple of things on this in the OPA is, if your patient is spitting out the OPA, please do not strap the OPA in, okay? It means your patient has a gag reflex and the OPA is not indicated in this particular instance. So I've seen in many situations people trying to strap down the OPA and the patient keeps gagging. If your patient is gagging, then they should not have an OPA in situ. If you still want to maintain an open airway in a patient who has a gag reflex, then what you can potentially use is what we call a nasopharyngeal airway. And essentially the nasopharyngeal airway is sized from the tip of the nose to the tragus. Okay, so tip of the nose to the tragus, and then essentially you want to lubricate it a bit. Just provide some lubrication on it, and using the bevel against the septum. So you do not want the sharp edge of the NPA injuring the patient's septum. So for this one, again, just simply. Now the trick here is do not push it up into the patient's head. You still need it to go down. So just slightly in, then just straighten it and just slide it down. All right. And similarly, the same thing, even if you're using the other nostril, for example, again, make sure the bevel is facing the septum, and again, slightly in, straight up, and then it slides down and twists. Okay. And you can even put two NPAs in, and a patient with no gag reflex, you can actually also put in an OPA in, and that way you have three devices that are all open up to the airway, and then you can actually provide bag valve mask ventilation to your patient. And in this situation, you're sure that the airway is patent. All right, so in an NPA, the main thing you will need to worry about is any patients with any facial fractures or any injuries towards the face, because then there is a risk that they may have injured the base of the skull, and that could then cause complications with that. So and the other thing about the NPA, you also make sure you have the correct size, because an NPA you can put in a patient who has a gag reflex. So and you don't want the NPA to be so long that it actually causes the patient to gag. So it needs to be the correct size. But the main thing is, and of course, the nasal passages of the patient must be patent. Do not force it in. It should be very easy, as I was demonstrating. It should go very easily. If you're struggling to put it in, then potentially try the other nostril. And if there's any obstruction, do not force the NPA in.